Hi everyone and welcome to Asamu Rat Care. So today's video is going to be all about little Faye here. And you've probably heard, if you've been keeping up with my videos, some of her troubles. So as you can see, she's got a very normal eye on this side. And yes, on this side, it's virtually non-existent, which is a big improvement on what it was like when it was about twice as big. So Faye has what we call, or had what we call, a glaucoma. So a glaucoma is something in the eye basically causing a blockage so that the fluid in the eye builds up and it basically swells and it gets bigger and bigger, and then something happens. So either the eye ruptures or the eye kind of ulcerates or dies back, or you opt to get the eye surgically removed. So a glaucoma is something that can happen of rats of any age. Now Faye had what we call a congenital glaucoma, which means it was something that didn't form properly. And there is actually some evidence to say there's genetic links there. Now it's the first rat we've ever had in the family with a glaucoma. And it's also a bit of a, for those of you that kind of breeding, just a demonstration that there are risks to outcrossing. So this was outcrossed to related rats that have never seen any problems with glaucoma too, and then we get one pop up out of the blue, completely weirdly, but actually she's still a very happy, healthy rat now. Right, so glaucomas. So we know roughly what they are. They know they're a kind of pressure build-up in the eye. So what I'm going to do now is show you a little bit about the progression with Faye. And I'm going to have to do that with pictures because I wasn't very organised in filming videos through that. I was too busy worrying about Faye, if I'm honest. So we'll start off and we'll talk a little bit about pictures. So I first noticed this when Faye was about, I think it was about 6.5 weeks old. It was literally after, so we normally pick our keepers about 6 weeks-ish old. That's a good age for us. And I'd literally decided that I was probably going to keep Faye because she was the nicest of the two girls, but I hadn't fully decided on that one, but it was likely that's the route I was going to go. I think the next day I noticed her eye was slightly bigger. It wasn't very much, but it was a little bit bigger. And then over the next few weeks, this progressed. So what I'm going to do now is I'll move over to this side a little bit so I can put up the kind of full progression picture here, or a good like level of the progression. So over the next few weeks, in fact, even actually over the next few days, so initially things grew quite quickly. Within about a week of me first spotting it, it was blindingly obvious that it was quite badly swollen. The problem was Faye at that time was a little bit over 7 weeks old, and that is not an age you want to put a rat through any form of surgery. However, in other animals, particularly dogs, there are kind of drops and such that you can use to try and control this. So I went to the vets to discuss it. It turns out that the drops are not ideal for the kind of glaucoma that rats typically suffer from. At least that was the belief of the vets at the time. It's not a topic I'm massively experienced with, given that this is my first glaucoma rat. But at least the reading that I've done, and actually found a really interesting scientific report that backed that up, and also linked with quite a strong genetic relationship. So I should say, if you are a breeder and you do have one crop up, I wouldn't be breeding on from that rat at all for obvious reasons, but I would think very carefully about breeding from that litter even, unless you're doing a really big outcross. That's the kind of situations you might choose to do it, but you wouldn't want to inbreed on that litter, definitely not. And you would want to be quite careful if you do use any rats from that litter, make sure they're worth it basically, and keep them to unrelated as possible. Yes, so basically I noticed this. One thing I should say, all through this time, Faye was, she showed that it was irritating her. She would shake her head occasionally, she would groom it a little bit. She had some sight in it for quite a while. That has long since gone, I should say that. But for quite a while she did have some level of sight in it, though it was obviously poorer than her good eye. It wasn't intensely painful. So what we see when we see glaucomas in dogs is they are incredibly painful, and that dog is really struggling. Now, whether it's because of the different kind of structures of rats or the types of glaucoma they have, I don't really know. But with Faye, it didn't seem particularly painful. It was something that I wanted to resolve because it wasn't nice for her. and she actually noticeably kind of put on weight slower than my other girls, though a good part of that could be that she's just Faye and gets distracted by anything. I don't know where she's gone now, that's why I got her at the start. She's somewhere in the rat room. She'll come and visit me eventually, but at the moment everything else is too exciting. We've got Juby though. You'll visit me, won't you, miss? Go on. But yes, so it's not intensely painful, but it is uncomfortable, and that's at least in my experience from Faye. Generally when you see glaucomas in rats, they tend to happen in older rats, and that can often be caused by an injury, so something around, where's Faye actually? Hey Trouble, back in the cage. Yes, so they can get an injury around the kind of corner of the eye which can cause this kind of thing. They can also have some other changes to the eye which can cause it. It's not a genetic problem generally if it comes on an older age. However, in kind of youngsters like Faye, it is something that is genetic kind of at her age, but that's kind of, it doesn't mean that you don't treat them in a very similar way. So we've seen that Faye's eye kind of gradually increase, and I would say it probably took about 3 weeks before it noticeably stopped growing effectively. So it grew quite rapidly at first, and then it kind of slowed down until we got to the point where it was relatively stable. What I'd agreed with the vet is we're going to basically try and get Faye to ideally 4 months, but we'd accept about 3 months to put her through the operation unless something changed and she was in obviously quite a great deal of pain. But she was a fairly typical little kitten, as you can see her now running around, doing stuff, being active, so we kept on trying. What then happened, one day I noticed that her eye had started to ulcerate. So this is something, and I'll put up the picture of her kind of ulceration progression now. So this is actually something that's quite useful to see, because an ulcerated cornea, as it's called it, the cornea being the kind of outer surface, the smooth shiny bits on the outside of your eye, is something that can happen to any rat, and it's quite often from an injury, a scratch or something like that. And it's something that you do need to take relatively seriously, but you can kind of fix usually, whereas an ulcerated cornea on a glaucoma is not going to fix in quite the same way, because ultimately it's because of the large eye. So I should say ulceration was far preferred from the eye kind of rupturing, but basically what had happened is because it was such a big prominent eye, she'd caught it, scratched it, and then that developed an ulcer. And that basically was noticeable by the surface of the eye being changing colour, different colour, and it gradually deteriorated and looked awful. I will say from as soon as it started ulcerating, we started using antibiotic eye drops on it. So these are good because they stop any infection getting in, and they will in theory help it heal. With Faye's eye, I knew they wouldn't help it heal as such because, like I say, the eye was broken in the first place. But it did basically ensure it didn't get infected, and that was really important. If you've got a rat with, you come to visit me, I told you she'd come round. If it was a rat with like just a normal ulcer, then you would expect antibiotic eye drops usually sort it out, unless it's particularly nasty. It normally sorts things out very well. Where do you want to go, miss? She can't make up her mind. No, don't dance on the microphone. Yes, bless you. Yes, so we then put these antibiotic eye drops on twice a day. She hated it. Actually used gel. I will say if you have a choice on those, go for something that's gel, because you can kind of smear it around the closed eye. They're not going to hold their eye open for you. And some gets in. I won't say it's an awful lot. She quite liked having the treat afterwards, so she's very easily bribed, which is weird given that she doesn't eat properly normally, like with her distraction from food. But she does still like a treat. She likes to feel special when she's getting food, bless her. Sorry, they just all like have to be in my face at the moment. Right, so ulceration happened, and what I noticed probably within a few days of it ulcerating is her eye actually started to slightly shrink. Now this is something that can happen both with glaucomas and ulcerations, where basically the eye dies off. That sounds horrible, but in this case it was actually really good news, because you see, if an eye kind of dies off and shrinks back to the point where effectively it's just a kind of nondescript, risk-free or very low risk kind of object left in the eye socket, you can't see out of it. I will say Faye could not see from her ulcer starting, but because their eye started shrinking, and the other thing I noticed was there was no more signs of the kind of head shaking, kind of irritation over it. So clearly this, sorry, Juby is trying to climb the camera stand again. So the kind of active ulceration started to relieve the pressure in the eye, which is when I got quite hopeful that we might be able to avoid that eye operation, because basically that was the plan. 3 to 4 months, remove her eye, which is a big operation for a young rat, which why we're trying to get into an older age. But it was definitely one that we needed to consider, because it couldn't stay at that large size, because like I say, it would get injured and it would get infected, and that would be bad. But so we managed to stay on top of the infection through applying this stuff, and then over the course of probably about a week, the eye shrank down and effectively died off, and that's what's kind of we've got left now. So Ferry basically has one perfectly normal eye that she can see out of perfectly fine, and one eye that is basically just a tiny little shriveled thing that is not harming her, and it's not causing her any problems in any way. So I took her and had it kind of checked out by the vet, and applied various dyes and such to try and check whether it was likely to be an infection risk or anything, and it's perfectly fine. It's just tiny, and she's entirely blind out of it. And it's something, it actually looks a lot like a rat that's born with microphthalmia, except she was born with a perfectly normal eye. So we're both very happy at the moment. I mean, it's something we will monitor, but I do know of rats that have had this happen from an ulcerated cornea or something similar before. And actually it's perfectly fine, and they get on well, and it causes them no pain, and they don't tend to get any complications from the kind of getting infection or anything in the future. Obviously you need to account that they are half blind in that side, so be a little bit more respectful. I thought I'd just demonstrate that little Eddie here is getting on a lot better, to say that she came here because she didn't like people. Where are you off to, miss? Yes, she's enjoying free range very much, and is a lot more relaxed around me now, aren't you, miss? There you go. Right, she's off. Yes, so this was like the kind of ideal outcome in terms of Faye, because basically it meant that she didn't need the eye removal. It's something that I've definitely done, and I will still do if for any reason it becomes a problem. But an eye removal is quite a big operation. It's very fiddly, particularly in a rat that is fairly tiny herself. One of my kind of full-sized rats might get on a little bit better because there's a bit more to them. But yes, so I'll try and show you. I'll put up a picture, because as much as I kind of show you up close, Faye doesn't do still very well. She's a typical kind of active hyper baby, if anything slightly more hyper than the rest of them. But it looks really good. Well, I say when it looks really good. It looks really good compared to the ulcerated eye and the really swollen glaucoma eye. It still looks freaky, and she looks at you like she's plotting your demise or something. But it's a very good outcome for her. So Eddie decided she would test dropping something off and ended up hanging upside down from the steps, didn't you, miss? Go on. Right, so that's a really good outcome from Faye, and something I'm very pleased with. It kind of goes to show you should take eye issues fairly seriously, and I'm glad I did. And we had various checks on her throughout that process. Lots of kind of they put this fluorescent dye in the eyes. I think most of it got over my hands, but it lets you check the surface of the eye and make sure that nothing's going too badly wrong. There isn't any fractures, like ruptures or anything in there. It picks up on any ulcerations that happens. So when you do see an eye issue in your rat, it can be worth having that done. The antibiotic eye drops or eye gel are really useful when you've got kind of minor ulceration on the surface, and those are kind of very helpful. What you will normally see though, if it's a particularly bad one, is you'll see kind of like they'll have quite a lot of porphyrin around the eye as well. I should say all throughout this, Faye never had any porphyrin around her eye, so I don't know if that's linked, but she's actually just been kind of getting on very well with it. Yes, I love you too, Missy. She's a bit of an attention whore. I think it's because she's had so much fuss from a young age, me staring into her eyes. You're going to be okay, dear. But yes, she's a very, very good little girl. So if you do have a glaucoma in an adult rat, I would say that I would probably, if it happened in a rat that was, let's say 5 or 6 months old, I would have probably given it a week or two to make sure it wasn't just going to go away on its own. You kind of live in hope, don't you? And I should also say, when it was at its full kind of bulging glaucoma phase, I kept lubricating eye drops on hand at all time. Now, Faye could always close her eye, and we did a blink check at least twice a day to check that she could close her eye, so her eye never dried out. But if her eye was going to dry out at all, those lubricating eye drops would have been essential. If there. Which would have been, which is why I had them in basically. I haven't used them, but it was always an option, and it's important to bear that one in mind. If you have a rat with a dry surface of the eye, they do need those lubricating eye drops, and probably more than twice a day as well. If it's not looking like it's improving quickly, or it's getting worse, or the rat is in discomfort, I would just get the eye removed. I think I've got a friend who's a vet that does quite a few eye removals, and she has good success with it. It's not an easy op, and I would definitely seek out a kind of experienced rat surgeon, particularly if they've done eye removals before. It would be particularly helpful. But even then, as long as they're kind of like really good at that kind of detailed work and they read up on it well, then that's okay. I'm quite lucky. I've got a very, very good rat surgeon locally to me, who basically has been there from checking up on Faye for quite a while now, and very much appreciated. So that's one thing to bear in mind with glaucomas. I've also kind of touched on ulcerations a bit. I will say I've had a limited number of cases where ulcerations have not resolved. Most of them, you put in your kind of eye drops for a couple of weeks and they sort themselves out. In extreme cases where an infection does get into the eye before you can kind of stop it, then you would do the eye drops, but you'd also want to pair it with something like doxycycline, which has got the best penetration into the eye. You do need to take these eye injuries seriously, because if the eye gets infected, effectively that's like a kind of highway to the brain as such, so the infection can spread into the brain, and brain infections are not something that is easy, and usually they have quite bad outcomes, so you need to be very careful of that, and make sure that you kind of treat early as soon as you think there's a kind of proper ulcer going on. So Faye is now in a very, very tenuous position. There, that's better. Yeah, she understands. She's got me wrapped around a little finger, haven't you? At the moment, and just relies on me to kind of catch her. Yes, this goes to show that half blindness does not stop a rat being insane. Yeah, so with your ulcerations, if you see a serious one, if it's stubborn and sticks around, then you would think about doxycycline. Run that for a week or two. But again, if it's not resolving it, then that's another thing that you would think about eye removal. And it is one to balance, because it's a lot more kind of tricky removing an eye that is infected than it is removing an eye that's kind of like in good condition, and that's because of the risk of contamination. Again, highway to the brain, but it's better than leaving it in there, if that makes sense. Of course, you've always got to consider quality of life for any major surgery, so if you've got an old rat that's struggling a little bit anyway, then you might not, she knows she's a star, doesn't she? You might not kind of put them through that surgery, but then it's one to kind of balance off. It's one to think in kind of quality of life, so I'm getting distracted by trying to keep an eye on what she's up to, because yeah, I should add, she didn't just scare me with her glaucoma. No, Faye being special, decided she would also somehow manage to sprain her leg so badly that I honestly thought it was broken. The vet honestly thought it was broken. And not just slightly broken, majorly broken. So she had an x-ray. More amusingly, the vet's small animal x-ray machine was broken, so she had to go on a horse x-ray machine. We've got a mixed practice where I quite often go. So this tiny little wee rat went on a giant horse x-ray machine to find out that her leg was in fact not broken. And she had a few days cage rest, and she's back to normal again now. But it does make me a little bit paranoid when she's climbing upside down on things. Which she takes full advantage of, don't you, Trouble? But yes, you can still see she's got a little bit of shaving just where they were having a better look at it and feel. But yeah, rats are fun. So that's probably it in terms of kind of glaucomas and eye ulcers. Trying to think if there's anything else that's kind of obvious that I can cover with regards to eyes. I mean, I should mention you may hear the term corneal abrasion put around as well. So that's basically where the eye surface has been scratched or damaged. That tends to lead to an ulcer. Other things that you can see actually that I'll briefly mention, that if I ever get a rat with one, which I hope I don't, I will do a separate video on because you probably need a bit more information, is other causes of eye swelling can be an abscess or a tumour behind the eye, and they are something that don't tend to go well, but you will find that the eye surface is in very good shape. It's very smooth and shiny. Just the eye is bulging. In fact, the eye itself, so the difference with the glaucoma is that you can see that the eyeball is physically bigger than the other eyeball, and you do have to take into account that when an eye is being pushed, bulging out of its socket from something behind it, there's more of the eye that's normally in the eye socket. But you can get an idea if that eyeball is visibly bigger, you're talking glaucoma. If it's just being pushed outwards, then you're talking that something behind the eye. Abscess or tumour, it's worth treating as an abscess unless you know not, and that would be like with any kind of facial abscess, clavamox and flagell, or otherwise known as metronidazole, together for a decent length of course, and see if it responds. If it continues to grow, then your choices are either to attempt an eye removal and hope that it's an abscess that the vet can get to when the eye has been removed, but that is quite a slim chance and the risk of infection is very high, or unfortunately euthanasia, because you're not going to get a tumour out of there. And in fact, most of the time it's quite painful. They have kind of bad headaches, because if you think, it's not only pressing so hard, it's pushing the eye out of the socket, it's pressing backwards on the brain as well. So those are very nasty, and I hope I never have one of them. I've seen them occasionally. Thankfully not in my rats personally, but it's very much it's not a good one. Let's face it, none of them are good ones, but that's particularly bad. It's like your ZGTs and that kind of stuff that we don't ever want to have in a rat. So that's that kind of thing you can see sometimes. The other things that you do sometimes see, and that is more likely, much more common to crop up in my rats at some point, though again I've not had it yet, is a cataract. So that will be perfectly normal eyeball, and you notice a little white spot on it. It's much like humans. Effectively, that's not going to probably hurt them. It's worth getting it along to the vet if you're not sure that it's a cataract, just to check that it's not an ulcer or something. They'll put the magic dye in the eye and check what the surface is doing. But cataracts are pretty harmless in rats. It's not like humans. You're not going to be able to kind of get them removed or fixed or anything. You just have to accept that the rat's sight in that eye is going to be poorer and poorer, and eventually they will become effectively blind in it. But rats do cope quite well with that side of things. You just got to be a little bit respectful with your setups, not change things too dramatically each time, and make sure that they can find their way around without flinging themselves into space and hoping for the best. But yes, so that's one thing. Another thing can happen with the eyes. I'm trying to think. You can get like a bleed within the eye as well. So sometimes you'll find a kind of black eye will turn itself red due to some reason. Sometimes that's accompanied by a glaucoma, so the eye swelling too. Sometimes it isn't, and the eye just changes colour. Typically they go blind in that eye. There is limited things you can do with it other than consider removal, but you would only really consider removal if it was likely to get worse. It was likely to cause them pain and discomfort long term, or they were struggling in some way, you know, you're quite worried about that eye. But those are probably the main things that happen with eyes. They're interesting little things, and by far the most common is a corneal abrasion or ulcer. Glaucoma is thankfully quite uncommon, as are kind of abscesses, tumours, and cataracts are reasonably common in old age, I should say. They're quite rare in youngsters. I do have a rat, Sol, who lives up there sometimes, that has an ever so slight scar on his eye, which looks like a tiny little milky patch, where him and Eclipse got in a small fight when they were younger, and it just slightly damaged the surface of his eye. But other than that, absolutely fine. it's not something that you generally see very often. But that's it. So main things with eye issues is get them checked out if you think that the surface of the eye is damaged in any way. If it's just a bit of porphyrin around the outside, give it a few days and see how it goes. That could just be slightly irritated from dust or something like that. Do treat with antibiotic kind of eye gel, eye drops to try and prevent infection. Do be very mindful of that with glaucomas. Do assess quality of life and consider removal if it's in the rat's best interest at that particular age. And basically see how they get on. Sorry, Snufkin is trying to help. You want to speak to the camera too, don't you? Right, so that's probably it from me, since the girls are quite demanding this evening, particularly little Faye, who knows this is her video. That's my ear. So I think it's also because I quite often give her extra food in the evenings. Her and Eddie are my skinny lot because they're just not as food obsessed as the rest, so she's probably thinking, why am I not feeding her? Right, so over and out from me and Faye, and hopefully that's been useful for you.